be a student nurse today, perform hand hygiene. Can you please tell me your name and date of birth?
Marley Monk, 3/10/2005.
Okay, perfect, it matches. Do you mind if I sit down and talk to you today about pressure injuries, why they are important to prevent, and different ways that we can prevent them from happening? Okay, thank you. So today, like I said, I'm going to be talking to you about pressure injuries, and there are different ways to prevent these from happening. Pressure injury is anything that has moisture, friction, or pressure to the skin. So different patients can develop these, and there are ways that we can prevent them from happening. One of the ways is by coming in every hour and repositioning you. Another way is to come in and elevate your feet or your heels, and we can also encourage oral fluids. And whenever we come in to reposition you, that's whenever I'm going to ask you to drink at least like 8 ounces or a bottle of water of fluids. And then I can also come in every hour whenever I'm repositioning you, and I can ask you like if you need to go to the bathroom. So whenever I say come in and reposition you, let's say that for 1 hour you're on your back, okay? The next hour I'm going to come in and put you on your right side. The next hour I'm going to put you on your left side. So that way we are like, taking off the pressure of the skin for, the right side, left side, or on the back. So 1 out of 4 patients develop pressure injuries in the hospital, in the ICU, and we prevent these from happening because it increases your risk to stay in the hospital or the length of your stay in the hospital. It also increases readmission rates. Now, can you tell me the different ways that we can prevent pressure injuries from happening?
Drink fluids, reposition, check the skin, and elevate your feet.
Okay, perfect. Now can you tell me, oh, I also forgot to tell you, I'm so sorry about this. I also forgot to tell you that every shift change, a nurse is going to come in and check your skin to make sure that you're not developing any pressure injuries. So today I'm going to come in and I already assessed your skin, you're not developing any. Now whenever I leave and we are doing a shift change, another nurse is going to come in here and check your skin as well. And then the following day in the morning, another nurse is going to come in here and check every part of you just to make sure that you're not developing any injuries also. Okay, so can you tell me how often I'm going to come into your room and reposition you?
Every hour.
Okay, can you give me like different examples of like what I mean by repositioning you?
So 1 hour I'll be on my back, and then you'll come in and reposition and I'll be on my side, and then an hour later come in and I'll be on my other side.
And what am I going to encourage whenever I come in and reposition you?
You're going to encourage me to drink fluids and ask if I want to go to the bathroom.
Perfect. Okay, and can you tell me how often we're going to check your skin to make sure you're not having any development of a pressure injury?
Shift change.
And
shift.
Okay, perfect. And can you tell me why it's important to prevent pressure injuries from happening?
To decrease medical costs.
It decreases your risk for any length of stay to the hospital, and it also decreases your risk for readmission to the hospital. Okay, now can you tell me or demonstrate for me how you're going to elevate your feet or your heels? Perfect. Okay, do you have any questions for me at all?
No.
Okay, are you sure?
Yes.
Okay, well, I really appreciate you letting me talk to you today about pressure injuries, why they are important, and the different risks that that are for developing a pressure injury. Okay, thank you so much.
Thank you.
Now I'm going to go ahead and I'm going to perform hand hygiene, and